Potassium, phosphorus, and chronic kidney disease. A Patient's Guide Chronic Kidney Disease, CKD, impacts how your body handles essential minerals like potassium and phosphorus. As kidney function declines, these substances can build up to dangerous levels, creating complications such as heart issues and weakened bones. The key takeaway: individualized dietary management guided by a medical professional is crucial. Why potassium and phosphorus matter in CKD. Healthy kidneys filter waste, including excess potassium and phosphorus. When kidneys fail, these minerals accumulate. Potassium, too much can cause cardiac arrhythmias, irregular heartbeats, a life-threatening risk. Phosphorus, high levels draw calcium from bones, weakening them and increasing the risk of heart attack or stroke due to calcium deposits in blood vessels. The exact limits for potassium and phosphorus intake vary. There is no single safe amount for everyone with CKD. Recommendations depend on disease stage, medications, and overall health. Potassium, guidelines and food choices. Experts suggest a daily potassium intake of 2–3 grams for those at risk. But this is not a universal rule. If you have early-stage CKD and no history of high potassium levels, restricting potassium may not be necessary. However, certain medications, like some blood pressure drugs, can raise potassium, so discuss this with your doctor. Prioritize plant-based foods over animal products and processed foods. The body absorbs roughly half the potassium from plants, like bananas or spinach, while animal proteins and processed items are absorbed more readily. Avoid these high potassium foods. Breaded chicken, chocolate and chocolate milk, coconut water, milk, coffee, limit to 2 cups, dried fruit and fruit juices, low sodium processed foods. Soup, pickles, potassium additives, found in some processed foods, potatoes. Chips, fries, processed meats, ham, bacon, sports drinks, tomato sauce. Phosphorus. Guidelines and food choices. Phosphorus is vital for bone health, but excess phosphorus can be detrimental with CKD. Damaged kidneys cannot clear excess phosphorus, which pulls calcium from bones, weakening them. For advanced CKD, a phosphorus-reduced diet typically limits intake to 800 milligrams per day. Avoid processed foods containing inorganic phosphorus additives, found in soft drinks, fast food, as the body absorbs nearly 100% of these. Choose these foods with caution. Dairy and eggs, fish, grains, legumes, meats, nuts, and seeds, vegetables. The bottom line: managing potassium and phosphorus in CKD is not one-size-fits-all. A nephrologist and registered dietitian can tailor dietary guidelines to your specific condition. Focus on a whole food, plant-based diet while carefully limiting animal proteins and processed foods. Regular monitoring and adjustments are essential for protecting your kidney health and preventing complications. Sources: National Institutes of Health, International Society of Nephrology, Cleveland Clinic, National Kidney Foundation.